First of all, I would like to welcome all of you to this webinar, and it is in fact lecture number 7 of this webinar series organized by IQAC Lakhimpur Girls College. Today we have with us Dr. Mythili Hazarika. She is Associate Professor, Department of Psychiatry, Gauhati Medical College. And we are very much grateful to you, Madam, for giving your valuable time with us. And we are very much thankful to you. And she will deliver a talk on mental health challenge during COVID-19 pandemic. When the lockdown was started, the students were at different stages of their academic year. Some of were preparing for some entrance examination, and some were at the verge of their completion of their degree. So now they are under tremendous mental stress. And so we think we need one psychiatrist to keep the balance of the students in this stage. So that's why the Department of Home Science of Lakhimpur Girls College has organized this lecture series. And I again give my thanks to Mythili Hazarika Madam for giving her valuable time with us despite of her
I'm going to give the introduction
schedule.
again.
So with this few words, I would like to declare this session open. Thank you.
She has completed her graduation in psychology from Ferguson College, Pune, and post-graduation from University of Pune in clinical psychology. She completed her MPhil from Nimhans, Bangalore, PhD from Gauhati University of Psychology. Dr. Hazarika had taken 1 year postdoctoral training in University of Florida, USA on neuropsychology and substance abuse. Dr. Hazarika is a reviewer of Journal of Psychiatry, editorial board members of Open Journal of Psychiatry and Allied Sciences. She is a member of the State Mental Health Authority, Govt of Assam, representative of UNICEF Assam branch, mental health expert of NIPSID Assam, and member of the Board of Autism Detection and Certificate, and many more national and international level organizations. She has presented scientific papers in 4 international conferences and 9 national conferences. She was invited as a resource person in 41 different CMEs, seminars, and conferences of national and international level. She attended as resource persons in several training programs for teachers, social workers, psychologists, lawyers, and other personnel. Dr. Hazarika has a publication of 37 different national and international level journals. She is the primary investigator of neuropsychological performance in men seeking treatment for alcohol use disorder, funded by Fogarty International, University of Florida, co-investigator of fetal growth, neonatal size, and its relation to body composition and insulin resistance up to 6 years of age, funded by ICMR. She is the president of the Society for Mental Health in Low and Middle Income countries. Dr. Hazarika and her teams researched the best practice guidelines for telepsychology during disasters, that is COVID-19 pandemic, published by Society for Mental Health in low and middle income countries, is very relevant to the present situation. Monon, Assam Cares of National Mental Health Assam, working on crisis management during pandemic, is also led by Dr. Mythili Hazarika. And through this organization, they are helping a lot of people who are in distress. Now, I would like to request Dr. Hazarika to start her session.
Yeah. Thank you. Good afternoon, everybody. Am I audible?
Yes.
Yeah.
Yes,
Okay.
yes, madam.
So it is a very elaborate introduction. Thank you so much, Dr. Rupa Roy, for this. And thank you, everybody. It's a delight to be here and share with you about the mental health challenges during this pandemic, and also about the different kind of mental health problems that we all face in our life. So I would like to start with some kind of a presentation here. But yeah, it's echoing. The voice is echoing. Okay, so during this yeah, is it fine? Am I audible to people around? I can't hear. Yeah, I can hear now, I guess.
Yes, you are audible, madam. You can carry on.
Okay. Yeah, so we all know how important is mental health, because as WHO says, there is no health without mental health and social health. And at this point of time, we are all under stress. Like, not only the people who are suffering from COVID-19 and who are in quarantine, the people who are like us, healthcare professionals, working day and night, we don't get leave. You know, we are not in lockdown. So basically, the frontline workers, the health professionals, as well as the legal, the police and other people are all in service at this point of time. And we had done a lot of research work in this area at this point of time. So I know all of you are students here, and you are going through a lot of stress. The student stress is immense because of their career, because of their ensuing exams, and whether you would be able to sit for your exams and pass, and what kind of profession you're going to take, what is the career choice that you have to take tomorrow. So there are a lot of so I'm going to deal with that one by one. At this point of time, I just want to share a screen right now. If I could just show this. Can people see it? Okay, so begin from the beginning. If I have to go, okay. It is just not stopping. I don't know why. Okay, so let me go like this. Okay, fine. So again, oh God. It just doesn't stop. Is somebody operating from there? No, no, because I don't know why this is happening.
You go to slideshow, madam.
Yeah, but this is, again, it goes. If I do something, it just goes. I'll just check again.
You click the from beginning button.
Yeah, from beginning I'm clicking, but it just doesn't stop. 1 second. I'll have to go one by one, I guess. Now, can you see?
Yes, yes.
Okay, fine, fine. So, so let me begin from here. The mental health challenges, as you can see, during pandemic is a lot. And I'm actually a clinical psychologist. I am not a psychiatrist. I have done my MPhil, PhD, and postdoc And the difference between a psychiatrist and a clinical psychologist is psychiatrists are MD, they have done their MBBS and they prescribe medicines for different kind of mental illnesses. And we provide psychotherapy and we do some kind of testing and different kind of issues in mental health. We deal in different kind of approaches, like, so I am from the medical college. I approached different people to give us helpline numbers, like phone numbers dibolo dilu. When what happened was when phone numbers number is used so like this we got that. So what we found that there was panic and anxiety regarding COVID-19 from the people. There were lockdown worries. There was depression. Depression means what? Depression mane hotaha. You know, depression is a mental illness. We cannot use this word depression just like that because it has certain criteria to follow to say that I am depressed. You know, we use this word as a layman. More depression or depressed lagise. We should not use this. We have to know what is depression first. Depression is a mental and a mood disorder. When a person feels sad from 7 to 14 days, it needs 2 weeks of time. দুসপ্তাহ ধৰি যদি খুব মনটো ভাঙি আছে, মনটো মাৰি আছে, খুব sadnessত আছে, and extreme fatigability, মানে খুব বেছি ভাগৰুৱা হৈ আছে মানুহগৰাকী, আৰু যদি মানে একো কথাতে interest নাই, lack of interest in daily activities, like, you know, the activities that used to give us pleasure, and we are no more pleasurable. We don't get any pleasure from doing anything like, you know, watching TV, talking to people, doing our daily work. We don't get any pleasure. And these are extreme cases. Then what happened? These are the 3 criteria. One is pervasive feeling of sadness, that is all the time feeling of sadness, lack of initiation, interest, and fatigability. These are the 3 features of depression. Tar uporot jodi manhor hopelessness ase, helplessness ase, worthlessness ase, like, you know, you don't want to, you feel that you are good for nothing and you are not worth it, and then people are not going to help you, you feel really helpless or high, and also hopeless. Hopeless is something which is a cardinal significant trait if one is depressed. If you feel that you're hopeless and your future is not going to be okay, then probably you have to do something about it and seek for medical help. So any of us having all these symptoms, on top of that, if we are sleepless, টোপনিটো ভালকে আহা নাই, সোনকালে উঠি উঠি গৈ আছো, বা শুৱাৰ সময়ত হয়তো বা বহু নানা ধৰণৰ নেগেটিভ কথা আহি আছে, we have a lot of negative thoughts, negative cognition, then we should go to a professional for medicine. COVID-19 hole manhu moriye jai loge loge. You know, all these had caused a lot of panic among the people, and there were a lot of people who had past psychiatric illnesses. Janeke agote jodi karobar illness hoi ase, bemar hoi ase, manoshik rog, teoloke hoyto ba dorop poa nai, they did not get medicines during this time of COVID. So because of them also, it was a relapse. You know, they again had psychiatric illnesses. There was fear of loss. Again, and they were like at a loss, like how to handle, because They did not know whom to seek for help, no lawyers, no friends to talk, to share their issues face to face. So these were different kind of issues that we had to deal. There were issues with teenage, like due to lockdown, they had affairs, they had relationships, and they could not meet the boyfriend or the girlfriend. And even there was expression of death wish. I really want to die. So there were issues with migrants. They had to relocate from different kind of states, and because of the insecurities of job, they are in extreme stress. There were phone calls for e-pass inquiries to us, that how to come from one state to another. Like people were calling from Hyderabad, from Bhutan, from Nepal. Amar phone calls like a phone call aru koi baidu keneke ahim ami amak e-pass di dioksun. Then we had to guide them and refer them to the designated centers for e-pass. There were also increased behavior addiction, like gadget overuse. Birat mobile phone arambho kori dise losuli bilake ar mak deutake najane ki obhibhabokokole they don't know how to stop it. So that was another thing, that how to time manage in the screen time management, basically mobile use, technology use, how we can reduce it. And there were issues about post-traumatic stress. They were concerned that this stress will again erupt or not tomorrow. So grief and loss issues were there, and people lost their own family members, and because of that they used to call us up and even cry. I had to handle one person. He was like crying because he did not know that his son had met with an accident, and he was in the neurological center, and he was a COVID-19 patient, and he did not know how to come out of it because nobody allowed him to come out of it. And his son died. That is, I'm not talking about in Assam, outside Assam. And he was not even allowed to go and see his son's dead body. So I mean to say, these are big issues, and these are issues that we used to read in our theory books as a psychology student. We never had come across such a pandemic in our life. This is unprecedented. Prathambar hoise nukata mahamari. We are all not prepared for it. So we are trying to get used to the fact that yes, this is something big, this is something huge, and let us see how we go about it. So there were some few case studies that I want to start my presentation with, some case studies. So these are real cases that I handled during these 3 months. Let me start with the first one. There was this lady who was only 20-year-old female. She had been referred to me by the district commissioner, Kailash Kartik. He is now the district commissioner of rural Assam. So he called me up one fine day and he said that, ma'am, please see this female. And she is crying a lot. She is in Mahendra Mohan Chaudhary Hospital in Gauhati. And she has a travel history. She's come from Bangalore and she's not been able to cope up with the diagnosis, and she is crying a lot. Then immediately I had to call her up and I had to talk to her over the phone and asked her what is the issue. Then she said that I was with my family members and ma deutar logote asilu Bangalore. Moi sihotor logote ahisu. Karure COVID hua nai. Why me? I think something is wrong with the diagnosis. I think something is wrong with the report. So she says that please take me out of this mess and I really want to go home. Aru kanda kata korise. He was just crying a hell lot. And then she had major adjustment disorder with mixed anxiety and depression was a diagnosis made. So at a notun situation, she was not prepared for it, and she also was not, she was confused. And I don't have any symptoms. So why is it that? And then I had really to make her understand about COVID, that there are asymptomatic cases. ভিতৰটো হৈ থাকিব পাৰে আৰু দেখা নিদিবও পাৰে, কিন্তু swab testত it is found to be positive. So you have to be patient and go with the diagnosis and respect the report and do what the doctors are saying. আৰু বেলেগ ধৰণে মই counseling কৰি I had to stabilize her. Then I had to distract her by giving her books. Books were not allowed. Then I had to call up the center head and give her certain books to read, or some modules and yoga and all. I taught her deep breathing exercises over the phone. So this is another case of a 23-year-old single young lady. A swalizoni asile hypochondriacal disorder with anxiety and depression. Mane hypochondriacal mane ki? hypochondriacal মানে এনেকুৱা এটা বেমাৰ যোনটো বেমাৰত মানুহে ভাবে যে মানুহৰ খুব ডাঙৰ অসুখ এটা হৈছে আৰু ভাবে যে এই ইলনেছটো ইজ নট কিউৰেবল এটাৰ পিছত এটা মানুহৰ ওচৰলৈ গৈ থাকে ডক্টৰৰ ওচৰলৈ গৈ থাকে টু ফাইণ্ড আউট ইজ দেয়াৰ এনি কিয়ৰ আৰু সেই মানুহজনে ভাবিছে তেখেতৰ কোভিড হৈছে so this person was completely মানে believed she was like she believed it completely that she had COVID and there's no other way out because she thought she had COVID because Borpetat asile Borpetar pa ahute Borpetar dujon manhor COVID hoisile hekhini homoy and she came from Borpeta and she had fever and then when she had fever she said this is COVID fever because I came from Borpeta and there were 2 people who had COVID then I had to ask her that did you meet these people was there primary infection the transmission to hobole hole you have to at least come in distance some kind of usorle ahibo laibo so did you meet these people then she said no and then did you ever think that you had met them somewhere then she says no but I heard that they are from Borpeta and I have come from Borpeta so and she says that I have because neighbors are saying that I'm having fever and I'm having COVID and I think the doctors are not diagnosing me well and these are the symptoms then again these are the misconceptions that we had to really talk but she would not agree to anything so we had to start with medications for her লগে লগে আমি দৰৱ আৰম্ভ কৰি দিব লগিয়া হল কিয়নো সাইকিয়াট্ৰিক মেডিসিনস এ কাম দিয়ে ব্ৰেইনৰ কিছুমান আমাৰ থট প্ৰসেস আছে যোন থট প্ৰসেসৰ কাৰণে মানুহে এনেকুৱা ধৰণৰ অবান্তৰ কিছুমান কথা ভাবে আৰু সেই ভাবি প্লাই হিতুতে ষ্টাক হৈ থাকে in order to come out of that medicines also help so she was given medicines as well as counseling তাৰপিছত third case এটা কোময় these are real cases that we handled here so I'm like kind of discussing with you so it becomes more interesting for you people to understand that what is it that we are dealing here now so this is a lady who is 37-year-old she's married she's a homemaker and tekhet ko perfectionist tekheto kam bilak ekebare organized sab bostu bu bhale thakibo lage tip top ke kam kore dhua bostu ke thui thake alopman obsessive hoy aru anxious hoy পটককে ভয় লাগি যায় কাবাৰ যদি কোনোবা যদি ঘৰৰ পৰা ওলাই যায় তেখেতে ভয় কৰে যে কিবা বেয়াই হল নেকি এক্সিডেন্টে হ'ব নেকি এনেকুৱা টাইপৰ কিছুমান চিন্তা তেখেতৰ হেতু ব্যক্তিত্বতে আছিলে এতিয়া কি হৈ গল তেতিয়া তেখেতৰ বাচ্চা দুটা আছে আৰু সিহঁতৰ লৈ প্লাই চিন্তা হল যে মানুহজনী মানে she had cough there is a dry cough that she has in this kind of a season এই কফটো যেতিয়া হল তেতিয়া তেখেতে ভাবি ললে যে she is having COVID and her children will get transmitted from her aru panic attack ho arambho korile panic attack mane ekebare ukhaluat kosto restlessness enuka lagisile je she is going to die she had panic attack thinking that her children will get COVID from her because she had cough and she was extremely restless she could not breathe she could not sleep she could not eat and at times she would feel that life is not worth living because if the children gets affected from her then what will happen to her so all these different kind of issues were there that made them very very panicky and restless and at times depressed and also death wish was there so these are real cases that we had to handle in the psychiatry department in OPD in our outpatient department during this time and these are case studies that we are writing right now in order to publish so the online study then what I did is these are different kind of things that I had been doing in these 3 months this is an online study that in the very beginning of March I had sent one survey all over India okay this was an Indian study on the general population to find out what are the psychological impact of the general people about COVID-19 so the aim of the study was to explore the psychological impact of COVID-19 during the initial period. So we took data from the first 21 days. So we found that depression, stress, and anxiety was quite high. And it was like 23.4. And 31% of them were depressed, and 36% were anxiety, and stress was more than 46%. And they were from young adults, from women more, single, from middle socioeconomic status, and definitely for urban locality. And most of them who, addressed the survey that we sent were students. And so here, in total, in the first study that I mentioned with Assam Police, there were around 239 people who had called, and 23% were having symptoms of depression, and the rest, 10% had anxiety spectrum disorder. I'm talking this in a disorder level, okay? This is disorder, not just feeling sad or feeling anxious. It is not. It is fulfilling the criteria of an illness. 46% had anxious preoccupation and worry about lockdown. And there were 13 callers who had expressed death wish and suicidal ideation, and they needed emergency help and medicines due to the interpersonal conflict, which exacerbated during the lockdown period. So we need to understand that, death wish when it is there, or suicidal ideation when it is there, it is considered to be an emergency. And we had to immediately call up the police, and they had to be intervened, and 2 of them had to be brought to the psychiatry department immediately for hospitalization. So these are different studies that was done during the COVID-19 by us here. And now going to our topic about the psychological impact per se. So what is important for us to understand, people regardless of exposure, exposed because we don't know till we do the swab test probably. And I have to, so people may experience fear and anxiety of falling sick. So, or helpless. So many times what I see, even our healthcare professionals, Muniz or colleagues, they also experience fear and anxiety, and they feel that, coming to the hospital, because Gauhati Medical College Hospital is a COVID hospital. And I am seeing the COVID patients also, as well as the patients through telepsychology, through video conference, that I go 2 days a week to GMC COVID hospital, and I see all the patients in the video screen, and I do counseling in a group therapy session, and I also do individual session in the video. So many times these people, they blame others who are ill, because today itself I found a lady calling me up and saying that she had come from Bombay, and people neighborhood are blaming her for going to Bombay and not allowing her to come out of home, not allowing her dogs to come out, and they're like pooping in the floor and everywhere, and the dogs were like, she did not know where to take the dogs because they were not, she was not allowed to go out, and nobody was allowed to come into her house, and the neighbors are shouting at her and calling her names for going to Bombay and coming from Bombay back home to Gauhati. So these are certain stigma issues that we are definitely having a tough time handling. Because a lady whose parents were in Mahendra Mohan Chaudhary Hospital, she called me up and she says that the neighbors are calling her names because the parents have got COVID, and she is going to transmit COVID to the rest of the population, the neighborhood. So I mean to say, these also leads to depression for the people who are not having COVID, and that may lead to stigma, and stigma might lead to mental illness, and the mental illness may lead to suicide. So many times what is happening is the people who have died or who had COVID or who cannot meet the other people, I mean to say from the others also whose family members are not affected, but one person from the family probably is no more, then they have problems that there was no closure. I mean to say the relationship did not have an end. COVID had happened, and the person was taken away from by the police and the healthcare professionals. Absolutely, মৃত্যু মুখত গ'ল গৈ বা মৃত্যু হৈ গ'ল গৈ, যোনখিনি মানুহ থাকি গ'ল সিহঁতৰ অদ্ভুত ধৰণৰ এটা খং, এটা ডিপ্ৰেশ্যন, এটা এংজাইটি, যে মানুহজনক লগেই নাপালো বা মানুহজনৰ লগত কথা পাতিবলগীয়া আছিলে, বহুত ক্লোজাৰ নহ'ল, মানে বস্তুবোৰ খুব সোনকালে হৈ গ'ল. So these are certain things which are very, very sad to handle for us, and we as mental health professionals, we get lost. To those who are sick and quarantined, they may experience same guilt and stigma. Bohutor guilty feel hoise je ami kod ba goisilu, ami jaboi nalagisile, ami ulai jabo nalagisile. So they have this guilt, and they feel that because of me, that other people are also having COVID, and so these are the mental health impact. So is this stress universal? Now coming to the fact that stress to hokoluke homane impact korise niki. Is this stress universal? What I understand is yes, this stress is universal. Hokoluke impact korise. Jar COVID-19 positive boli koise, hihote ji hetu isolation at gusi goise because they are isolated from the family members. Their stress is more because suddenly there is a kind of a detachment from the family and in a hospital setting and other people they're seeing aru kisumaner hoyto ba besi significant problem hoy ase tetia dekhi thakileo hiator problem hoise. So the some reasons are, yes, this stress is definitely universal because it is something which is uncertain. Jetia ami gom pao je eta muhurto ahe life we don't know what is going to happen, it is so uncertain, it is definitely stressful. Jikono bostu amar porikhar khetrot hok amar student hisabe amar porikhar khetrot eta iman uncertainty, I mean to say people are at a loss je amar porikha hobo nohoy, open book hobo, closed book hobo, career pam online hobo, everything is so uncertain. So uncertainty always leads to stress. Uncertainty hole bostu eta jeti ami gom na pao tetia hole manoshik chap tu khubei pore. Fear of dying and death is always there, as we all know. Unprepared, sudden. This whole thing is so sudden, so unprepared. We were not prepared for something like this. So definitely stress is there. Lack of adequate knowledge is there. People do not have knowledge about respiratory illness, about COVID, about so many things. So because of that also, because of lack of knowledge also, people are under stress. Non-adaptability. Non-adaptability mane ki? Ami, as people, we are rigid people. We human beings are non-adaptable. Ami potokke change eta potokke ami lobo noaru. Because we do certain things in a particular way. We get up at a particular time. We eat our own likeness food. We dress in a particular way. We do our daily duties in a particular manner. And suddenly there is a change. It is a routine to a change hoye jay, jete adapt koribo noaru. Tetia hole there is a lot of stress. The change or logot adapt kora capacity to sobor iman na thake. So we are non-flexible. So it's extremely anxious, we guilt, as I said, and there's another thing is called existential anxiety. Existential anxiety bohutor hoise. Why am I alive? What is this? Bohutor logot kotha patute koi je, is this life? Etue niki. Jodi etue life tetale meaning to ki life or. Ami jodi sob enake lockdown hote bohi thikibo logia hoise. Kaile najano bhobisyotut ki hobo. Then is an existential crisis. That do I exist? Who can I represent myself? We as human beings are actually what? I mean to say, animals or birds black are free right now. Is it that we were creating a lot of nuisance to the animal kingdom? Hekane amar eta punishment hoise. So all these are different things that are in mind in people during this time of COVID. And the most and the best and the worst thing is that there's no treatment as of now. Amar eko treatment nai, eko vaccine nai. So that is creating a lot of stress in people's mind. So now I'm coming to child, adolescent issues, domestic issues, and elderly population or kiki hoise. So when we talk about children, all of us have children at home. Amar sabore lursuli ase khorot by adolescent population ase. What is happening in the developing minds? The peer knowledge. What kind of knowledge they are getting from their peer group is very important. And these children are high in their physical energy. Physical energy burn koribolo activities nai. And they have a high need for social play. The children are extremely stressed out because there is a disruption of their normal routine. They are worried about their loved ones. There is diminished care and supervision or more care and supervision. Over involvement to dekha goise parents or majot. They are taking care of the children more than what is required at this point of time. That is also creating stress. And there are certain parents who are neglecting them because they are under extreme stress because career nai, paisa nai khorot. So the children are neglected. And the children also do not know what is happening. Because they are at a completely lost kind of a status, more so in cities. Gaon by rural area, khula jaga ase, flats nai, apartments nai. Amar Gauhati khubei besi problem hoise because Gauhati apartments bahut. Because of the apartments, children are not allowed to come out of their flats, and to be inside 1 or 2 rooms in flats is a very, very stressful thing. And they are cranky, they are crying, and they are helpless. Our disability to our problems, our physical disability assets, our mental disability assets, our autism assets, our ADHD assets, and attention deficit hyperactivity disorder, autistic children, they are having extreme degree of problems because the parents do not know how to handle them, because the parents send them to special schools, otherwise the whole daytime and the hyperactivity, the restlessness in these children are taken care by the special school people. But now the parents are extremely stressed because they don't know how to handle them. They're every day, 24 hours, 24/7 inside the apartments. So these are real issues, and we are finding it very tough to handle them. So preschooler stress symptoms bilak hoise enekwa, the stress signs, thumb sucking, bedwetting, clinging, parents clinging to parents, sleep disturbances, irritability, khub khongal hoi goise, khub khingkhingya hoi goise lora cholibor, nightmares dekha hoise. Horu bacha ejoni hetna mur usole ahise 6-year-old, and she says that tai nakhaye eko khwa nai, mak deutako khub problem, ahi pela muk koise baido eko nukhwa hoi gol bondho. Moso kiyo koise dingit bole kiba covid lagi ase, aru bole covid to bole tai bole khale covid to khumai jabo betor bhitor, so she is only having liquid food. I mean to say, I really was shocked how to handle the kind of knowledge that she is getting from elder ones, that covid khumai jai and covid to dingit boji ase, and she is not eating because of that, and she will not listen to me because she's a highly intelligent girl. Even if I tell her that no, it is not, she is not going to listen. So I had to do different kind of play techniques with her, different kind of storytelling, and I kori bujai, I made her understand that, little bit of food, frequently start taking, COVID is not going to enter in your stomach. So there are a lot of issues of eating and withdrawal symptoms, like, they're not talking to elderly people, they're losing interest. Now, all these, if it happens for 2 weeks, then definitely you people have to take them to mental health professionals, psychiatrist or psychologist, problem thakile. Another thing is about domestic violence. Domestic violence to eta notun bostu nohoy, manhor porialor majot junbila kajia hoy, etu ekdom notun nohoy, etu puroni kotha, relationshipot kajia pesa lage. Khong rag sobore khong hoise primary emotion. It is an emotion that we all have, but otimatra khong, which is a control harai jwa khong, is not good. When you cannot regulate your emotions, when you cannot control your anger, then definitely it is harmful for yourselves and other people. And it can occur in heterosexual relationship, men and women. It can happen in same-sex relationship. It can involve parents. It can involve elderly. It can involve anybody. Violence is ubiquitous. It happens across people, across sexes, across caste, creed, across money. I mean to say, it is not about only people who are poor, are violent, or elite class. No, it is seen across all population. So as we know, physical abuse is about causing fear, pain, injury. Sexual abuse about sex in an exploitative fashion. Verbal methods are used. Verbal abuse is about criticizing, insulting, denouncing, using abusive language to threaten, to denigrate, to embarrass the victim. Enuka dhৰণৰ যদি শাৰীৰিক নিৰ্যাতন বা মানসিক বা যোনটো আমি কওঁ সেক্সুৱেল যোনটো আমি কওঁ এনুকা ধৰণৰ যোনবিলাক হয় যৌন সম্বন্ধ to married couples মাজতো abuse হয়. So all these are domestic violence, and I'm now going to do a study on the domestic violence in women who call up 181. 181 is the helpline. All of you should call up 181 if you are abused by anybody. Because the other day a girl, a medical student, she called me up and she said that she's abused by her mother, and she needed help from me. And she's a medical student, doing her MBBS, and she says that my mother is abusing me, ma'am, and she is not listening anything to me, and she's physically abusing me, please help. And to that extent, people are asking for help. And 181 is the helpline for domestic violence. And we have now 385 cases in 181, which we are going to deal individually, talking to them about their problems during lockdown period. From lockdown, that's 24th March till now, there are now 385 cases. So emotional abuse is also very high, trying to control, manipulate. Economic abuse, if your money is being taken over, if your economic resources, you don't have any control on that, then these are called exploitative economic abuse by other persons. So in domestic violence, what happens is that, first a perpetrator, junjon manhe mane to abuse kore ba violent method use kore, tekhete prothomate khub bhalke morom lagake kotha kisman koy, khube attract kore the women. It can happen from both sides. I'm just giving women as a victim here and men as a perpetrator here. And not because it is the norm, it is just an example I'm saying, because nowadays, men are also abused by women in the same manner. The report is very less probably because of humiliation and shyness and stigma issues. So, ইয়াতে যোনটো মই লিখিছো এই সাইকেলটো যোনটো দিছো, if you can see the cycle very well, প্ৰথমতে হ'ব খুব হানিমুন ষ্টেজ এটাত যায় মানুহবোৰ, when you are in love, you are in a honeymoon stage and you don't know what is right or what is wrong. Then you enter into the trap, and that person concerned, he is going to isolate you from friends and family. He will give you so much of love and so much of affection, and showing that you don't need anybody else in your life. অকলশৰীয়া কৰি দিয়ে মহিলাগৰাকীক। যেতিয়া অকলশৰীয়া কৰি দিয়ে, একেবাৰে নিজৰ কৰি ৰাখে, কাৰো লগত মিক্স আপ কৰিবলৈ নিদিয়ে, ওভাৰ পজেছিভ দেখুৱায়, তাৰপিছত কি হৈ যায়, then she doesn't have any contacts with anybody, she doesn't get time to talk to anybody. Then he kind of asserts his violence and control on this person, not to do this, to do that, and a lot of abuse. Then during that time, she already is in a kind of a depressed kind of situation, cannot come out of the trap. And then when she retaliates for some reason, then the person says that, you are being nasty to me because I gave you so much of love, and so I am doing this to you. And that person also feels that this person had given me so much that he can control me, and she cannot come out of this whole cycle of psychological, trap. So that happens, and then what happens, the abuser then plays the victim role and blame the woman when she tries to retaliate. And this is the way, it's a never-ending cycle. And then again, the abuser will abuse because the victim has abused the abuser now by whatever retaliation she had. So this is something we have to always understand, that being in love doesn't mean that the other person can abuse you for any case whatsoever. So I have to stand for your right. Another thing is about elderly care. Why care for the elderly? In almost all countries, older people are facing threats and challenges, and more than 50% of all fatalities involve people aged 80 years and above. And older people are, we know, they have severe illnesses, physical illnesses. Because of physical illnesses, the psychological illnesses are also very high. But we should not think that because physical illness is there, so they are bound to be depressed. Depression is an illness, anxiety is an illness. So always remember, comorbidity may be there. There may be physical illness to thakibo pare, psychological illness to thakibo pare. Kintu physical illness thakar karone is a psychological illness thakibo, that is a wrong concept. So always remember that elderly people should not be depressed. Jodi depressed hoye ase, lost feel kori ase, mon beya kori ase, they need treatment. They have to be seen by a psychiatrist. So during this time of isolation and quarantine, older people need safe access to nutritious food, basic supply dibo lage, paisa ase nai teolokor logot, medicine ase nai, are they being taken care of for their physical illnesses, jodi diabetes hoy ase, hypertension hoy ase, medicines kini hote pai ase nai. So people should take care of that, and they should be given a routine, like how to stay active, how to eat nutritious balanced meal, so that they become self-reliant. Or jodi kenabake technology hikai dibo pare, it is well and good. They can be in touch with others through video conferencing, and so many techniques are there nowadays. So older people should be treated with respect and dignity during this time of pandemic. Teolokok etu bujabo nalage je tekhetolok ami isolate kori disu because ostracized, stigma, because of discrimination. No, they should be made felt that teolokok ami ekane isolate hoi thakibo rakhisu for their safety as well as for others' safety. And it is because they are doing a great task by being isolated. So make sure that they know that teolokok je ami enake rakhisu, teoloke amak bohukhini sahay kori ase, hetu karone nijor sahay hoi ase. So management of psychological issues through generation. How are you going to manage all these issues? So basically with children, you have to talk to them in a very calm and assured manner. Introduce COVID as a kind of flu and give the germ theories. They can get germ hoy, manhor can get infection hoy. Do not scare them. Give correct information. Do not give misinformation. Avoid magnifying thing. Bostu to dangor kori keteo dibo nalage. Ji hoise, just a matter of fact, give intellectual understanding to them. Tell them what to do. That is hand washing with soap as a song, as a reminder. Create a song that, with song, gan gai jan bujabo pari je hat khon dhubo lage, gan gai bujabo pari je durat thakibo lage, so that they feel that it is a game rather than something very scary. Also to disinfect it, surfaces. So sometimes what happens is that they do not understand what is infection. So then you have to do something like this. Just for example, colored water এটা স্প্ৰে কৰি দিয়া হয় যদি white paper এখনত যেতিয়া পেপাৰখনত পানীখিনি বিয়পি যায় বুজাব লাগে যে এনেকে বিয়পি যায় এই বেমাৰটো সেইকাৰণে অকনমান কিবা এটা পৰিলে গোটেইখন বিয়পি যাব so it is always important to keep the distance because of that যে এটা মানুহৰ লগত স্পৰ্শ হৈ গলে বস্তুটো আহি যাব just like the colored water in a piece of paper. Secondly, you can say something like this. If they say that I don't want to wash my hands with soap because water is enough, then you have to give some glitter in a person's hand and say that, okay, wash with plain water. Then the glitter will not go with plain water. Then give the soap and then say that, okay, now you wash. Then they will know that, yes, this COVID is like the glitter. It just sticks onto it. So you have to really wash it well. So in that way, different kind of methods that you can use of not sharing cups and utensils with other people, not to cough like that. You have to put your elbow like this while coughing. So, all those kind of methods needs to be told to them. So provide very brief and simple information, give examples, use language like adults are working for your safety. You do not have to worry, give them reassurance, positive reinforcement. So with elderly school children, you have to be a little bit more vocal and verbal because they need to know what is the meaning and what are the facts. And they need also assistance for separating the rumor from the fantasy. So there will be a lot of rumor about COVID. So we need to understand that this rumor should not be indulged upon, should not be reinforced. So we have to normalize and address their concerns. With high school students, give always honest and accurate and factual information about the current pandemic. And also engage them in different kind of decision making about family plans, the scheduling daily chores, daily activities, and delegating responsibilities with their feedback. How to deal with their anxiety, teach relaxation, different kind of relaxation methods are there, deep breathing, pranayam could be important, normalize their feelings, and also coach to practice positive self-talk. Self-positive talk, nothing is great. It is just an illness. It is going to settle down. And I'm above this illness. We have faced a lot of challenges in our life. Ami life ot bahut challenge par kori ahisu individually. Kintu ei COVID to ami collectively share korim etia. Gote manukhini ekagruto hoi pelai ami kori asu. We are fighting, all of us. It is not an individual problem. So in order to tell us again and again, to tell yourself again and again, which is very, very important. So, certain things are very important is talking to your parents about their lives, how they have come to this point of time. Many a times we do not know about our parents. We do not know anything about our grandparents. Ami koka aitar kotha ekoi najano. Ami amar ma deutar kotha ekoi najano. Sihotor life stories bilak najano. Probably this is the time to talk. This is the time to know about each other, and also practice the gratitude exercise. Like make a list of things for which you are happy and you are grateful to the Lord, the things that you have, like eating food, being in a sheltered home. Think about a migrant population. They had to run errands to come to their home. So sometimes it is always required to place a jar with all different kind of activities and different kind of things for which you are, positive and grateful to the Lord, and pick up that activity and do that activity, and also pray to the Lord that you are alive today, you are healthy today, and you are safe today. Make a routine of learning at home. Like, for example, encourage the habit by setting adequate time for learning every day, giving short assignments related to lessons learned, and check the progress. For the students, I would always advise you people to make a routine. This is not the time to make an unstructured life. Your life has to be in structure. Unstructured, but you can make your life still a structured life. All the time, routine khonor mote soliba. Routine is very important in life. We feel it is not important to make a timetable. Amar janeke schoolot amar timetable mote classes hoy, college ot tumalokor etia hoi ase, that is also important at home. Always keep a we time, family time together. That is also timed. Give Monday, and this time is the family time, this time is study time, this time is assignment time. Give assignments to yourself, because knowledge is not only about giving exams and getting marks. Knowledge is about everything in life. You have to learn to be in this society, to live life. So I think you can keep on studying whatever you want apart from the academics. So always remember that being getting marks and getting some degrees doesn't make you educated and cultured. So always remember, even if you do not pass your exams, your education is not counted on that. So start gaining knowledge from whatever sources. Now is the time for digital life. See, I'm here today trying to say something to all of you. Probably all of you know what I'm saying already. But certain things I'm probably giving a little bit more information today only because of this digital world. So in that way, you can go inside different kind of conferences, seminars, enroll yourself and try to be a part of those seminars and conferences every day, because you can get knowledge from any remote corner of this world, and do not shy away and do not hesitate to learn new things. So people are not, women tolerate domestic violence because they are not aware of the trap that I told you people. We are not aware of the trap because we are so much in love with that other person. We don't know how we are getting victimized by that other person. So we do not know that this is an abuse. Compensation to jobs outside home. Many a times women feel that, you are working outside, so they have the right to actually abuse you because they are giving you to remember that, as human beings, we are all at par with each other. So do not be in denial, never be in denial that you're abused by the other person. There could be family and social pressure not to talk about the abuser, but just come out of that. So always remember that. According to National Family Health Survey from 2015 to 2016, 30% of women suffer from domestic violence. Domestic violence, 30% are physical violence, 30% spousal violence, out of which 30% is domestic violence. 30% of that 30% is physical, 30% is husband or spousal violence, 8% is sexual violence, and only 14% sought help to stop it. So you can imagine the, kind of a status. So many countries have reported domestic violence against women across the world, which is about 30% since lockdown. So if we extrapolate, like for example, if 30% was already there before, and from lockdown, if it's 30% has increased, then you can imagine domestic violence and stress will be 60%. Mane 30 agote asile, 30% domestic violence lockdown or pisot hol. Ami jodi extrapolate koro data to, titale 60% hobo domestic violence, which is very, very huge. So what is important is that a person who is abused economically, emotionally, verbally, sexually, or physically are in stress, are in anxiety, are in panic, depression, increased risk of suicide. And because of that, a lot of suicide is taking place. You can see all over the world as well as in Assam. So what is important for us to understand is why it is happening. Why it is happening is because we can see a spike in domestic violence during Ebola crisis in Africa, and when Hurricane Katrina also struck in the United States of America. I was there in America when Hurricane Katrina just kind of, it was bad. Anyway, so reasons were that earlier issues gets activated, it gets aggravated, there were a lot of other hurricanes that came after Katrina. This was like, I have seen US after that, and how certain people had right now also after so many years, how they are suffering. So earlier issues gets aggravated, stress and frustration gets aggravated, displacement of anger. Why is it happening? Because, people are angry because of the lockdown. So displace the anger on their spouses. কি হৈ যায় মানুহে খং কাক কৰিব পাৰে যোন নিজৰ মানুহ তেওঁলোকৰ ওপৰতে খং কৰিব পাৰে সেইকাৰণে কি হৈছে মানুহৰ ফ্ৰাষ্ট্ৰেচন বিলাক নিজৰ ওয়াইফ হাজবেণ্ডৰ ওপৰত দেখুৱাই আছে আনএমপ্লয়মেন্ট ইস্যুজৰ কাৰণেও খং হৈছে সেইকাৰণেও ডোমেষ্টিক ভায়োলেন্স হৈছে আনসাৰ্টেনিটি মই যোনটো কৈছো কেতিয়াবা স্পেন্ডিং মোৰ টাইম টুগেদাৰ আমি ইমান ইউজ টু নহয় আমি ফ্যামিলি হিচাপে ইমান একগ্ৰতা একেলগে থাকাৰ সেইকাৰণে একেলগে থাকাটো এটা বেছি হৈ গৈছে বেছিকে একেলগে থাকাৰ কাৰণেও কিছুমানৰ হয়তোবা সাফোকেটেড হৈ গৈছে so all these reduce access to basic resources. So individual level out, what you have to do is break the silence. If there is a violence, talk about it, seek active help codes কিছুমান আমি ৰাখিছো psychologists বিলাকে আপোনালোকে ফোন কৰিব পাৰে 104 104 is available. It is like 104 you can call up for any kind of mental issues and say that I want to talk to the monon group. আৰু কেতিয়াবা কি হৈ যায় if a person is abused they can't say that I'm abused. তেতিয়া হলে এনেকুৱা ধৰণৰ কিছুমান কোড ৰাখিছো আমি লাইক যদি আপোনালোকক কোনোবাই মাৰিছে কোনোবাই বেয়া ব্যৱহাৰ কৰিছে just say what is the time just say this so hey psychologist বা psychiatrist এনেকে ক'ব তেতিয়া আপোনালোকে যদি ইফালৰ পৰা কোড কৈ দিয়ে যে what is the time তেতিয়া I know that you are being abused and we will do something about it to take you out from that place এনেকুৱা ধৰণৰ কিছুমান আমি শিকাই আছো isolate the perpetrator যোনে এনেকুৱা ধৰণৰ violent attitude কৰি আছে তেওঁলোকক এটা ৰুমত বন্ধ কৰি দিয়াটো is important. Taking pepper spray, red chili powder, helping an escape plan এটা ৰাখিব লাগে, how to escape from that scenario. You are not going to be in that household. Do not get trapped by that cycle, because domestic violence under any circumstance is not justifiable and reasonable. Early elderly needs care during a breakdown because they need a lot of support, and now it is lockdown. Support has to be in a very different manner, though not physically present. So they need a lot of company. They cannot live without company, so you have to provide them the company through some measures. Talk to them on and off, make them understand that you are there. Do WhatsApp video conferencing, do some kind of webinars, call them in Hangout. There are a lot of methods. Teach them technology. Focus on the positive and the golden years, bygone years. Talk about the memories that you have gone through all these while. Write experiences of COVID, whatever you are going through at this point of time. Jikhini apnalok obhigota hoi ase ekhon notebook ot likhi jaok everyday ghotonabur keneke apnaloke heri bhabi ase keneke experience kori ase, because when these days are over you'll forget what had happened, and human memory is very short. Ami khub hunkale pahori jam, amar smriti shakti tu nai bolibo pari. Hekane it is better that when it is all over you just go through what we had passed through, and these are real good stories to talk to your children and grandchildren, that we had passed through all these, and we have such kind of webinars now. So older adults may be experiencing significant isolation, social distancing, which I said. Practicing exercise is very important, like how we are doing in the COVID ward right now. Ami video conferencing koru, ami exercise bilak koi thaku aru teloke kori thake. So you people also can do to your parents, to your grandparents, that talk to them and say that digholke ukhalok, eri diok, hatkhon uporle diok. But all those different kind of things you can keep telling them for 5-10 minutes, and they do it on the other side of the mobile. So these are certain things that probably, and also it is important that give them the assisting devices like hearing aids jodi kabar nai hetu ase ne nai, glasses ase nai, chashma jo bhangi gol niki, dentures and that dupari ase ne nai, walking stick to ase ne nai, wheelchair jodi bound hoy wheelchair khon bhal hoy ase ne nai. So you have to know all those. If you don't know all those, then you will not be able to take care of their basic needs. So is there any symptoms of distress, anxiety ase niki, death wish or kotha koi ase niki? So you need to also address those issues. So a lot of time should not be spent on the COVID news. So you need to take the news from reliable sources. That is very important. From WHO or Ministry of Health and Family Welfare, ABLAC sites are authentic sites, and you can take information from all these sites. Bakipur sites basically lobo nalage. There are certain recreational activities like board games, cards, chess, reading, listening to music, and all those definitely all of you are doing, but always have to support and protect the older people, and always do not think that is that family's business, because amar to koka nohoy hison, amar to aita nohoy. No, think as a community, and community level at bhabibo laibo, sobe ekelege bhabibo laibo, because we are not alone here, and we should not think that it is none of our business. It is everyone's business. So always remember that this is temporary and phase and not long lasting. This too shall pass, but only when we act responsibly and collaboratively. Physical safety has to be maintained, and you have to restore the normalcy and the quality in daily routine. This is the best practice guidelines for telepsychology during disaster, which I have written along with my colleagues. This is available. The site is giving down there. Hazarika, Vidas and Hazarika, this one, best practice guidelines for telepsychology during disaster. A lot of things are written here. If you're interested, you can definitely go through it. And if there are any psychology student, probably it will be of help to them in certain ways. So I think I would like to take some questions now. And this is in a nutshell about the various issues that I have come across, and also the issues from the research perspective, and what you people can do to yourselves as well as for your family members during this COVID-19 pandemic. Thank you very much for a very patient hearing. I'll stop this sharing of the slide now probably, or I go on like that. I mean to say, I want to stop it now. Yeah. Right. thank you, everyone. And I hope I could address certain queries, but I want to see what is written here so that I can deal with certain issues if it is there.
Good afternoon, ma'am.
Mm-hmm.
There are some queries which are surrounded. So first query is from Anushka Barua. She has two questions.
Okay.
And first question says, how to deal with clients in online counseling? The next question.
Sorry? I can't hear. It's a lot of noise.
Ma'am, there are a few queries. Few of the queries. The first queries that has arisen is it's from Anushka Barua. She has two questions. The first question, it says, how to deal with clients in online counseling?
Yeah, I can see the questions. Anushka, yeah,
And the next question is, in online counseling, which platform is reliable for audio?
I can see the questions.
Okay, and because sometimes it is difficult. And that's a query that has arisen from Anushka Barua.
Yeah, it is echoing again. It is echoing again. Right. So Anushka Barua, she is a counselor, it seems. Yeah, am I audible?
Yes, yes.
Yeah, so yeah, thank you everybody for such wonderful feedback. Am I audible?
Yes, yes, madam.
Okay, so I'm very, very thankful to everyone who has given such good comments. There are certain queries about the online counseling. See, we are now doing online counseling to COVID-19 patients. I'm leading Monon Assam Cares from Assam government. And everybody of us, like 220 counselors are there in our program. And we are individually talking to the COVID-19 patients. There are around 4,000 every day, 3,895 or 4,000 people are given to us. And we are taking all these 1920 each COVID-19 patients to each of the counselors. And we are trying to individually call them through 104. If anybody wants to join us, I'm going to train them. I or one of my colleagues are going to train them and talk about online counseling and how to go about it. That is one thing. No, voluntary counselors, but they have to have masters in psychology or sociology background and have some knowledge about counseling. That is one. Number two, I have already talked about my basic practice guidelines, you go to National Health Mission website. Just click National Health Mission Assam. All right. And when you go to National Health Mission Assam, you go to Monon Assam Cares. There is Monon Assam Cares in that website in the homepage. Click on that. Then after clicking on that, go to all my videos. There are a lot of videos that I have made, and there is a video on telepsychology counseling, where I have talked about everything, every chapter from these best practice guidelines in detail, and it is in video format. I have also talked about how to deal with cases. There are 2 case studies that I have talked about in that video. Go through it, how I have handled each cases, okay? Everything is in detail, how the person talks, how I talked, how the other person talked, how I talked back. So, you know, you will get a detailed presentation there. Just go to National Health Mission website, Assam, Monon Assam Cares, you'll get all the information there, and also about best practice. After that, if you do not understand how to do online counseling, just write call me, or I'll give you some phone numbers. They will also guide you, okay, for the counselor Anushka. Another thing, a person had written about how to control anger easily. You know what? Anger is something, I said it's a primary emotion. Now, all of us gets angry. So if you think that your anger just triggers for something, there has to be some reason for that. You will not get angry just like that. First, you have to deal with the cause of that anger. You know, if it is your personality, then definitely you have to do therapy on yourself, that how anger has probably damaged you rather than did something good on you. Still, if you had gone through therapy, if your self-reflection you have done, you know what is wrong with you, medicine paয়, তেখেত নিজে এজন doctor, I don't know whether a PhD doctor or a MBBS doctor, but I think a PhD doctor. So I would ask you to talk to a psychiatrist, okay? এনেকুৱা কিছুমান medicine থাকে, যোনটো পটককে যেতিয়া ট্ৰিগাৰ হৈ যায় নহয়, মুখত জিভাত দি দিব লাগে, এটো SOS emergency wise তেতিয়া calm down কৰি দিয়ে, লগে লগে calm down কৰি দিয়ে. So you can do that also, you can take that medicine also, and do pranayam, do relaxation exercise, as it is very very important to control your anger. আৰু এটা method আছে mindfulness বুলি, okay? Download it from the website, mindfulness based stress reduction, MBSR. It's a Buddhist philosophy. Just download that and do mindfulness based stress reduction every day, and your anger should come down. That is from my side. I hope it addresses your query. And anything else? Thank you so much. I'm a psychiatric social worker working. If anyone need help, then please feel free to contact with us, Parivartan Trust. Okay, good enough. So Purna, you can also come and join Monon if you want, and you can contact some of us in Monon Assam Cares. And if you're a psychiatric social worker, all the psychiatric social workers from DMHP, district mental health programs are with us. You can contact any one of us, and you can have some experience with COVID-19 patients directly, talking to them. And these are wonderful, enthusiastic group of people. They are doing their work every day, calling them up for 1 hour, at least 10 people. Is there any negative impact on pregnant mothers? Again, I said the stress is affecting everybody. If you're talking about pregnancy, yes, as we know that pregnant women should be in a non-stressful environment. So definitely they should not be stressed. But again, it is all in the mind, okay? It doesn't matter even if you're pregnant, but if you're positive, if you have a positive set of mind, and no environmental stressors is going to really influence you. So probably you have to definitely talk to the mother about being positive all the time, and to think about something which is good happening in her womb rather than what is happening around her. There is no such immediate effect of lockdown on new mothers. There is no research work I have seen, but definitely is something we have to keep in mind, you know, while dealing with pregnancy. Anything significant that I have to address? Ma'am, I want to know how to deal with increase of irritability and anger in women during this pandemic period. It is not only the women are anxious or irritable, it is, everyone is irritable and angry. Even the children are having a lot of behavior problems. So definitely you have to do behavior therapy on yourself. And you have to always know that this increased anxiety and irritability is coming from something, and that is the thought. Okay, and so thoughts needs to be replaced positively, because if you're thinking negative, you'll feel negative and you'll behave negatively. So always cognition has to be under your control. Just modulate your thought process. Do not magnify, do not think it is something big. Things will ease out slowly, but definitely you have to adapt to the changes and do something different, because now is the time to try new things and different things and go out of the monotonous routine that you had, or the normal routine that you had, because that is really not going to be feasible anymore during pandemic. You have to learn to do new things in a new manner. You know, that flexibility needs to be always practiced. Anything else? All these are thank you messages. I am highly delighted. And I think my voice is breaking because you know what? I've been talking like a pig, like a donkey's day from morning till night, only talking over the phone and doing counseling every day. And just now, you know, I'll read out one message that has come just now in my mobile from the how police are helping. Every day I'm getting messages from police. Right now the DGP had given me a message just before starting this. See, I'm going to read out the message, okay? This is a practical thing that I'm doing with all of you, with confidence that you're not going to share with anybody else. Sir, I am Dipankar Sharma from somewhere. You know me very well. I have done the blah, blah, blah. Sir, in this pandemic period, we are in a very big trouble. We approach our somebody, a minister, for us. Not begging for money, sir. Please don't misunderstand me, but I need help and I may get depressed and may do something which should not be done. I mean to say, see the level of, you know, depression and anxiety that people are, and this is personal cases comes to me like this, so that I handle it then and there. And I had to call him up and find out what is wrong with him. And definite stress because event manager, so event managers have, you know, stopped functioning because it's a lockdown period and they have no other income. So how to change his thought process, how he has to think differently and think that is a temporary phase and should not think negatively anymore. So, you know, all these are big issues. So I think we have to know what we are dealing with, but with a very, very positive frame of mind. And extremely much more lessons we have acquired through this knowledge. Okay, fine. Wants to know the mental stage of pregnant women in this pandemic. Okay, I think somebody is very worried about someone's pregnancy. Okay, and I would definitely like her to call me up, and my number is 98640304331. Okay, if one of you is pregnant, you can definitely call me up. Or if you are concerned about a pregnant woman per se, please call me up, 98640304331. This is for only an urgent issue that she had written. But as I said, there's nothing difference. We can talk about a pregnant and a non-pregnant women, but definitely we all know that during the time of pregnancy, stress has to be less. Keeping that in mind, ask her to do breathing exercises, yoga, and always keep her away from any kind of COVID-19 news. Do not let this woman talk and people talk in front of her about death, dying, and COVID-19 information. This is the simple ABCs that you can do at this point of time. First, keep this woman away from news that is derogatory. Second, ask her to practice deep breathing exercises and mindfulness. As I said, mindfulness-based stress reduction. Third, She can become a bit more spiritual, read our, religious scripts like anything. It could be Gita, it could be, if you're a Muslim or a Christian, the Bible or anything. But to be in touch with the Lord and also be a little bit more spiritual rather than religious, because spirituality always helps. Anything else? How to motivate oneself if he or she is suffering from any kind of depression or any negative environment. Yeah, this is about, again, writing down your thoughts. You have to motivate yourself because you always will not get a therapist to do treatment. You know what? This world is full of good and bad things. Okay? So focus on the goodness of it. Because if you selectively abstract and selectively focus on something which is negative, you will definitely feel depressed. So tease out things which are positive in your life till today. Write down the things that has happened which are positive in your life and how you had met a lot of challenges in your life, because individually we are not here today with no challenges. From the day we are born, probably when the child is born and the mother's umbilical cord is cut, the child had to go through a lot of challenge inside the womb. So we have a basic capacity to endure challenge. Always remember that. The other things a therapist or a medicine professional will do is only augment it or only reinforce your capacity and your potential. You have all the potential to deal with life. So reinforce your belief system, confident, think about the thing in a very challenging, positive manner. Do the same thing when depressed. Do the same thing as you have done before. And write down positive thoughts and experiences in life. And always engage in activities. Don't be idle. That is very important in life.